Hello, I'm Emma, one of the midwives at St Peter's Hospital, and I'm here today to talk to you about pain relief options in labour. This is often a thing that women have a lot of questions about in labour, and it's important that you know the choices that you have and that we inform you well about your choices. So, midwives tend to recommend that you start off with some lower forms of pain relief, and as you require more pain relief, that you almost work up a ladder. So we tend to treat it a bit like a step approach. So on the bottom, this might be when you're at home in early labour, getting a few contractions that are a bit irregular, a bit uncomfortable, but you're beginning to feel like you might need something to help you while you're at home. So you might often hear us recommend, when you call us up, about paracetamol and a shower or a bath. Paracetamol is a really good one to start off with. You can take 2 tablets, and that's every 4 hours, but don't exceed more than 4 doses in 24 hours. This doesn't completely take away the contractions, but it does just help you cope with that. It almost takes what we call the edge off the contractions. So those are really good ones to start with. The other ones you could try at home are a shower or a bath. So water immersion is a really, really good one to have in labour. Again, the warmth of the water really helps to ease the pain. It can make you feel very light, takes away the heaviness of the sensation. So that's something that we always recommend first of all. The other one is obviously when you are in established labour and in the hospital or the birth centre, you can use the birthing pool. We don't recommend this or the use of this before you are in established labour, as there's some evidence to suggest that it can slow down labour if you go into the pool before you are 4 centimetres with regular contractions. Again, women tend to love the birthing pool. It really helps give a sense of lightness and ease, helps you achieve lots of different positions in labour, and also the warmth of the water helps to relieve the pain. Once you're in hospital and once you are in established labour, the next one that women often like is Entonox or gas and air. This is piped into the wall and it comes with a mouthpiece like this. Gas and air is a mixture of oxygen and nitrous oxide. We tend to recommend that as soon as you get a contraction, you pop the mouthpiece into your mouth, you breathe deeply on it, and breathe deeply out again, back into the mouthpiece. The majority of women tend to find this really effective, and for the majority of women, this tends to be their preferred method of pain relief. When they've done surveys, a lot of women will say that this is the one that they prefer out of all the pain relief options. You can have this gas and air in the pool as well. You can also have it with other forms of pain relief, such as pethidine. It doesn't cross placenta. As soon as you breathe it out and stop breathing it, it is out of your system. The only sort of side effects from it, or the downsides to it, are that it sometimes makes people feel a bit sleepy. Some people say it makes them feel a little bit sick, a little bit out of it, and a little bit away with the fairies, as we would say. Some people don't really like this sensation. But again, if you don't like this sensation, you just breathe normal air and that sensation leaves you. It's best to tend to breathe it throughout the whole contraction. A lot of women will put it in their mouth and take out the mouthpiece as soon as they hit the height of the contraction. It's best to keep it in your mouth throughout the whole contraction, because when you reach that peak of the contraction, that's when the gas and air takes its most effective. The other one I haven't actually mentioned is the TENS machine. This is one that a lot of women will use in early labour, and you can also be used throughout labour. It comes like this as a little machine. You can either buy them online or in Boots, or you can hire them in Boots and some other stores. They work with the theory that there are 2 pathways of pain that run down our back. So if I'm imagining this is somebody's back, and these are the 2 pathways, the TENS machine then works with 2 sort of sticky pads, 4 sticky pads actually, running alongside your back, and each time a contraction starts, this machine then has 2 little wires that are connected to the pads. You then press the boost button. This then sends an electrical impulse, and it feels like little tingles on the back, and it helps to distract from that contraction. And the theory is that it breaks this gateway or this pain pathway and interrupts the pain. Majority of women who use it find it really, really effective. A lot of women who think it isn't working will take the machine off and then find out that actually it was working and put it back on. You can have it with gas and air, and obviously with things like pethidine. You can't have it, however, in water because it does use electricity, and obviously for safety reasons we can't have you using one. The other one you could try that we can offer you in the hospital is codeine. Sometimes if you're in early labour and you're a bit uncomfortable and we examine you and we find out that you're not in established labour yet and we think the best place for you would be home, then we might recommend that you go home with some codeine and some paracetamol. So codeine is 2 small tablets or 1 small tablet. Again, it can make you feel quite sleepy, but it does just help to take the edge off those contractions and really help you through the early stages of labour. The next one is pethidine. Pethidine is an opioid. It comes as an injection in your leg. We give it with an anti-sickness because without an anti-sickness it can make you feel quite sick. It works really well. A lot of women find it very effective. It does make you feel quite sleepy. Again, it doesn't completely take away the contractions, but it's just a step up. Lost my steps now. It's just a step up from things like paracetamol and codeine. We wouldn't probably go with this as the first form of pain relief when you come in to see us. We'd probably recommend that you try some other ones first, but it is a very effective form of pain relief. The downsides of it are that it does make you feel quite sleepy. Some women don't like this feeling of being very sleepy, whereas other women quite enjoy it and are able to get some sleep in between contractions. It does cross the placenta, however there are no adverse side effects to baby. The only time we wouldn't offer it to you is if you are 8 centimetres or further along. This is just because as it crosses the placenta, there is a slight risk that it can make your baby sleepy. If you are in early labour or in the less advanced stages of labour, this is not a problem because by the time your baby has been born, those effects should have worn off. But we don't offer it to you later on just in case those effects haven't worn off yet. The next one is an epidural. This is the one that a lot of people want to know about and are interested in. So, fire about This is one that can only be offered up on the labour ward because it requires us to monitor your baby continuously, and it's also administered by an anaesthetist, and we need our rest of our obstetric team around to really help you if there are any needs to be helped. So again, if this is your back, just going to draw your spine running here as well. So the epidural is inserted using a fine needle that goes in around the lower space of your back. It's inserted in between the two, some of the bones in your spine, and it's inserted into something which is known as the dural space. And this is again a little space in between your spinal cord and the bones of your spine. A needle goes in and the anaesthetist then inserts a fine catheter, so almost like a thin plastic tube that goes into your back. This is then connected to something called fentanyl, which is a form of pain relief, which goes into that space. It then numbs you from around your stomach downwards. This is probably the only form of pain relief that will completely take away contractions. The positives of it is that it's a very good form of pain relief. Women often speak of it very highly and they do enjoy it. The downsides are that sometimes it doesn't completely take away contractions. You can still feel things like pressure and some sensation. Also, it has been known sometimes to raise your temperature. It does mean that you won't necessarily be able to walk around in labour. You can still change positions, but you just won't be as mobile as you normally would be with the other forms of pain relief. We do obviously need to monitor your baby continuously. To pop the epidural in, we do have to have you sat up and hunched over, and then obviously once it's in, we sit you back in a more comfortable position. We wouldn't recommend an epidural in the early stages of labour. We would probably only recommend it when you are 4 centimetres or more. Sometimes, if you are nearing the end of labour, Often women ask if they can have it now, and we tend to recommend that we can give it to you, but sometimes there isn't quite time to get it in before you deliver. But on the whole, it does have very good reviews. Women do enjoy it. The last one to talk about is hypnobirthing. While this may not be called a form of pain relief, this is more a coping mechanism, and this is discussed in one of our other videos by one of our other midwives. And again, it just helps you feel relaxed, gets you into that zone, and really helps you through labour.